Critics of the Affordable Care Act who say the health care overhaul law has no teeth, they may have a point. Literally, at least, dental coverage is seriously lacking under the act, according to dentist industry experts. We have Jen Wieczner of MarketWatch.com join us right now with all the facts of this. Hi, Jen.
Hi.
Let's talk about this. A lot of people wondering, after all of the work that went into this law, how could this be? Where is the dental coverage in this?
So there isn't much. There's no extra dental coverage for adults. There are some provisions for children. So the insurance that will be sold under the exchanges is required by law to include things like medically necessary orthodontia. If you have a severe overbite to the point that you can't eat,
right.
Things like that, and limits on out-of-pocket spending for children. And small business plans. If you insure your kid on your plan, you also have to buy them dental coverage somehow. But for adults, there's no requirements, and it sort of goes along with what we've always had in the health insurance industry, where dental is separate, and so they've sort of kept it separate and out of the Affordable Care Act.
Now, some experts say this is part of just a growing, more worrisome trend in general related to dental coverage and just sort of the health of our teeth collectively as a nation. Tell us a little bit about that.
Yeah, so children have actually been doing well in terms of dental. More of them are covered, and more of them are seeing dentists. But adults have actually dropped. I think it's down to only 37% in 2010 from about 41%. So adults are going to the dentist less, and fewer of them have coverage. But interestingly, so the Affordable Care Act is expected to add about 5 million kids to dental insurance plans, but because those plans will be more expensive and the parents have to buy them, about half of those parents will drop their own coverage because it's not required, and so it could result in a net loss of about 7 million people with dental coverage.
So if you think about that happening, the Affordable Care Act being short on these provisions, does this just mean that more people, I'm trying to piece this together, will show up in the ER with major dental problems?
Yeah, they do expect that. It's already a trend that's on the rise. It's about the people going to the ER for dental problems has doubled to about 2 million more since 2000. And so there's a lot more people coming into the ER because they don't have insurance to go to the dentist, and they expect that to continue because there's only less of them will have dental insurance after the Affordable Care Act.
And what are dental industry advocates trying to do just to make sure that people are going to have coverage in light of this issue?
So the ones that are coming into the ERs, they're often sending to community centers. A few different states have programs where people who come into the ER without insurance, they can send them to a center somewhere else where they can get more affordable dental care, community centers, so that doctors might be donating their time, dentists, to give them that care so they don't have to take it to the ER, which is very expensive.
Very important issue. All right, Jen Wieczner, more on MarketWatch.com. Thanks for being here. Appreciate it.